هنتكلم النهارده عن ophthalmic ultrasound. Now I'm going to talk about the basics of ophthalmic ultrasound. Dr. Nihal will talk about pediatric ultrasound, and then I will talk about different diseases with ultrasound changes. Introduction: B-scan ultrasonography is an important adjunct for clinical assessment of various ocular and orbital diseases. With understanding of the indications and proper examination techniques, one can gain a great amount of information, which is not possible with clinical examination alone. B-scan ultrasound is most useful when direct visualization of intraocular structure is difficult. There is such impossible situations. We can't see what's inside the fundus, so we are going to talk about these impossible items like lid problems, severe edema, corneal opacities, just like scars or edema, as the photo says, different opacities in the media. So we have to use ultrasonography. Also, anterior segment opacities like hyphema, hypopyon, meiosis, pupillary membranes, and dense cataracts. And finally, vitreous hemorrhage, vitreous opacities like vitreous hemorrhage or vitreous inflammatory depress. This is ultrasound instrument, and we have actually different types of ultrasound instruments. Basis of ultrasound is very important, not only to know about it, but also to use how to use the prop, how to use the arrow of the prop. So optically, when a sound wave moving in the air and hits a solid surface, it reflects off it. This reflected sound is called an echo. And the same applies to a sound wave moving through water and hitting an obstacle. This use of echo is the basis of ultrasound, and the pulse of the sound that is used should be short with high frequency, as they travel further without being absorbed. These sounds used for ultrasonic range with frequencies is from 1 to 20 megahertz. These frequencies can be obtained by using piezoelectric material. So when an electric field is placed across the slice of one of these material, the material will contract or expand. So rapidly alternating electric field causes the crystals to vibrate. This is the crystals. This is the probe of the ultrasound, as we see. Here is the electric supply, the wire, okay? And here we will find that piezoelectric material is put in that slide. When this piezoelectric material moved in a wave of contraction and expansion, it will vibrate ultrasound, just like that. This is how they use it. This ultrasound will passes through sensor and screen, passing to the screen, and then give us the ultrasound photo, which may be A scan in the form of echo or B scan in the form of images, okay? Hyperreflective or hyporeflective. So when this crystal is vibrate in and out, and this will resulting in a signal that can be amplified, may be amplified or not according to the gain. You can increase the gain or decrease the gain, and processed as the crystals are built into the same handheld unit, which is called an ultrasound transducer. There is three types من الامplifications احنا ممكن نشوفها, just like linear amplification, logarithmic amplification, and S-curve amplification. Now we will talk about the gain. Ultrasound system allowing the examiner to adjust the amplification of echo signals displayed on the screen. It changes only the intensity of returning echo that is displayed on the screen. The higher the gain level, the greater the ability of the instrument to display the weaker echo. So, when I want to see vitreous opacities, and this vitreous opacities is very weak, I will increase the gain just to see it very well, okay? When I want to see an intraocular foreign body. Intraocular foreign body usually with a high gain, with a very high gain. I will decrease the gain, so any noises will be disappeared, and only the echo of the intraocular body, which is high, will still present on the screen. Okay, that's why I can move the gain up and down, and there is different things where you can increase the gain. Different diseases you will increase the gain, and another, if you want to see the choroid, it's better to decrease the gain. Okay, this will let you see the choroid well. If you want to see cupping of the optic nerve, you may decrease the gain. Okay, so there is many other things to when you can increase the gain or you can decrease the gain. So the higher the gain, the greater the ability of the instrument to display the weaker echo. Okay, vitreous opacities and membranes. Conversely, the gain is lowered only when there is a stronger echoes will continue to be displayed just like the intraocular fallen body. Okay, this is B scan and A scan. So we have to tell you that no sonar without both A scan and B scan. Okay, so this is an A and B scan ultrasonography showing intraocular foreign body with posterior shadowing and high echo after eye decreasing the gain. You can't see anything with the except of a very mild gain here. Okay. A scan, each layer producing a reflection. Now we are talking about A scan echoes. Each layer producing a reflection show up a peak. This gives rise to a name of technique and amplitude scan or A scan. Amplitude, A scan, the name is coming of A scan from amplitude, which could result from the layers in the eye. This should be familiar to all ophthalmologists ever performed biometry. All of us is doing biometry and know what is about A scan. This is difference A scans, and it represents. So when the sound hit the cornea, it will make an echo. When it hits anterior segment, anterior surface of the lens, it will bring an echo. When it hits posterior surface of the lens, vitreous, retina, choroid, posterior global wall. Okay, so the echoes is the reflect of hitting the ultrasonography inside the eye. And now we can see that this is anterior lens spike. This is the posterior lens spike here. This is the retina, followed by orbital spike. And this is the prop, and this is the eye, okay? This is basis of ultrasonography. Now we can see the A scan here, while here is the B scan. And as we know that A scan is the reflection of what you can see in the B scan. B scan, the largest amplitude, gave rise to a spot with greatest brightness, here shown almost white. So when there is something with a large amplitude, it will be on the B scan in a form of white, okay, white color. While the smallest amplitude, things with echo, when you hit with a very small echo, just like the vitreous is actually with no echo. When the pathways of the ultrasound passes through the echoes, it will not give any echoes, or a very, very, very weak echo if there is any vitreous floaters, okay? So it should be appear in the form of black color. While there is an intermediate echo, which may give you some resistance, just like the lens. Lens is giving some resistance, so it may appear in the form of weak gray color. If the lens is give you a white color, echo is increased. This is meaning that the lens is cataracts. Okay, we are now not talking about the echo. We are talking about the B scan, the colors. This is a normal B scan. You can see white color of B scan only, not A scan, of the posterior lens capsule. We can tell you that this is a well delineated posterior capsule. This is the shadow of the optic nerve head, and you can see the vitreous here is completely black, okay? So the corneal spike and retinal spikes have the best amplitudes, and therefore they appear nearly white. But the cornea, we are not talking always in the cornea of the in the B scan, because we actually can see it through the slit lamp, so no comments about the cornea. The posterior lens spike has a lower amplitude than anterior lens spike, and therefore it's appear darker. The aqueous and the vitreous allow the sound to pass through with a little impedance or a little resistance, and therefore they appearing black. The lens substance over some resistance, so therefore it doesn't appear black. It may appear in the form of gray color. And this is another B scan. Advantages, we know that the ultrasound is non-invasive, it is not harmful, the method is relatively inexpensive, it's very quick, and ultrasound is studying the image in the soft tissue. All of this is the privileges for the ultrasound. This is the last topic in my lecture, which is how to screen. During the basic screening of entire globe, I need a pen, please. If anyone have a pen, I need a pen. During basic screening, the entire globe must be examined from the posterior pole out of the far periphery. So each quadrant is evaluated carefully. I have a 4 quadrant to evaluate or screen through the globe: superior quadrant, inferior quadrant, nasal quadrant, and temporal quadrant. Here you can see the probe and the globe, and there is also a positions. What is the meaning of position? When the probe is placed on the globe, it is represented by initial white color in the left eye display screen. The vitreous cavity is displayed in the center of the echogram, and posterior pole is displayed in the right eye, and there is a marker, usually in the form of a dot and a line on the side of the probe handle near the face. Here is a probe, okay, and here is the marker in the form of a dot, or it may be in the form of an arrow, small arrow, okay? It's according, and it's different from an instrument to another instrument. This is another instrument where you can see the arrow in another place. Positions is very important. What is the meaning of axial position, and what is the meaning of horizontal axial, and what is the meaning of vertical axial position? Axial position is mean that you are going to go directly to the center of the eye, okay? Let us tell you that this is the probe, okay? The pen is a probe, okay? And this is the arrow, okay? When the arrow, most position is preferring to put the arrow nasal, okay? This is temporal and this is nasal. So I will put the probe directly in the center of the eye. The arrow is nasal. This is the axial position. Why axial? Because it passes to the center of the eye, the center of the lens. So the lens should be in my photo when I take it, in my capturing, and also the optic nerve. So when you are taking an axial position, your photograph should include the center of the lens and the optic nerve, okay? So this is an axial position, okay? Taking the center of the lens and the optic nerve, okay? What about if it is axial vertical or axial horizontal? When this arrow is nasal, this is mean that this position is axial horizontal. Why? Because the arrow is nasal or temporal. It's okay. I prefer it to be nasal, and there is actually many schools for sonar. If you like to read about sonar, there is the biggest book for sonar called Sandra, okay, showing different positions for the arrow and the probe. But let us do something fixed. Make the position of the probe axial when you are going in the center of the eye, and let your arrow nasal. So when your arrow is nasal, the central half, the central upper half upper of the screen will be nasal. If the probe is nasal, the upper half of the screen will be nasal. So the temporal part will be down. If you want to screen the macula, it will be down. Okay? If you want to screen the macula and the arrow is temporal, the upper half is temporal. It's according to the arrow, the upper half. If the arrow is temporal, the upper half will be temporal. If the arrow is nasal, the upper part will be nasal. That's why if you want to know about the macula and you can see and there is an opacity in the media and there is any tumor will be approaching to the macula and you are afraid how you are going to approach in an opacity media, you will do the sonar, taking it axial and nasal, so the upper half will be nasal and the macula and will be down. Okay? This is an axial position. You can see the lens. You can see the optic nerve. Also, it is an axial nasal, so the upper half of the screen, so this is the optic nerve, the upper half of the screen, so what is above the optic nerve is nasal, and what is below the optic nerve is temporal, so the macula is here. Okay? This screen is divided by the optic nerve to upper and lower half. When the marker is nasal, the upper half is nasal too. Horizontal scan in an eye with vitreous hemorrhage, the posterior lens surface is seen centers to the left with macula centered to the right, here the macula, while the optic nerve is seen just above the macula since the marker is directed nasal. Thank you. This is the main important basics of ultrasonography, is how to use the prop in different quadrant, how to adjust your position, which should be axial, taking with you the lens and the optic nerve, and finally how can you approach to the macula through the marker. Now, thank you so much.